My name is Dr. Buonassisi, and I'm a board-certified facial plastic surgeon with a practice in Vancouver, Canada. I've been specializing in cosmetic rhinoplasty for almost 20 years, and I'm here to answer your questions about this very interesting procedure. Happy patients are educated patients, and that's why every question is a good one.
So some of the challenges of a twisted nose are related to what's causing the twist. So a very thorough examination of the nose during your consultation is really important. Sometimes the tip cartilages, the upper lateral cartilages are twisted, but more often than not, it's actually the nasal septum. That's the divider in the nose. It's a wall that goes from the front of the nose all the way to the back, and it's really the main support strut for the entire nose. And if that septum is crooked, often the entire nose is crooked. It may not be possible to make it completely straight, but often straightening the septum can have a significant improvement on the external appearance of the nose. Now, it's important to realize that the nose can be made straighter, but not totally straight. And I think that would be a realistic expectation with rhinoplasty, is that you could have an improvement in the straightening, but not perfection. So how the nose is straightened surgically often is from a ground-up approach. So the nasal tip and upper lateral cartilages need to often be separated from the nasal septum so that the reason for the crookedness can be not only diagnosed but repaired. This is done best absolutely through an external approach. You need to be able to see what's causing the crookedness. You need to be able to physically modify that structure and secure it. So it's not just about moving a structure over, you've got to make sure it stays there. If you have a bent septal cartilage with a curvature in it, moving it over doesn't necessarily get rid of the curvature. You've got to deal with that curvature. And how is that done? Sometimes incisions are made in the cartilage. The cartilage can be cut and then overlapped, but then has to be reconstituted with sutures and repaired. That's not really possible to do without using an external approach for that. Diagnosis and management is much more accurate with the external rhinoplasty approach. It's very important to correct the septum first and then suspend or resuspend the other cartilage structures onto a straightened septum. And that's the best way to get the nose straight from ground up.
Thanks for listening, and check back regularly for new questions and my honest answers about rhinoplasty.